Hello, my parents doctor. Welcome to medical science class. As a student of medical science, I wanted to take flavor every bunch of science. What kind of things say do that is, but that is knowledge, that is this, and that is good, or that is an art. As a Muslim, Allah is the one and only to accept all allegation, last and best messenger Muhammad. Medical science class. Ya alif lam lam ha yellow shapi yellow mapi yellow kapi anar abdul mamushil shapi anar abdul mamushil mapi anar abdul mamushil kapi. Now my parents about a medical science class. Uh, Medical science class. Uh, Medical science class. Oh, medical science class. Medical science. As a doctor, Dr. Soel. Those patients believe me as a doctor. My registration number. You as a patient, you should have right to know the any doctor registration number, registered doctor or not. My registration number 75,995. 75,995. 75,000 75 909 759 75995 75,995. That is my Bangladesh BMDC registration. In case of my profile already given registration number, as a patient you should have right to know the registered doctor or not. Bangladesh Medical and Dental Council. Now, what is medical physics? Medical physics by utilize energy correct the disease. That is medical physics. What is medical chemistry? Medical chemistry by the utilize of the fundamental unit or complex unit of drug cure the disease. That is medical chemistry. What is nuclear physics? By that process, atomic nucleus or atom utilized as a medicine, cure the disease. In case of nuclear medicine, I also research and I take the drug for that purpose and its work or not. Nuclear medicine. By the name of Honesty Mighty Pool Gas Science Pool one and only Ketori ALLAHU. And it is for me as a doctor, my safety security, and those are my patient. Believe me as a doctor for them. Those are my patient. Believe me as a doctor and respect honor with due respect honor for them, not other and personal. Wait, let me see. For the lab physics, what is lab physics? By that policy, your lab stamina increase. By that energy utilize and stimulus. If husband wife agree, labology not sexology. Labology purpose. Like physics 10. Okay, fine. Lab physics for labology. Yeah, wadu di Allah Abdul Wadu. Lab chemistry factor. Yeah, wadu di Allah Abdul Wadu. Lab physics by that utilize energy, your lab stamina increase. And lab chemistry by that you utilize. What is lab chemistry? By utilize energy, you lab stamina increase. Just a sildenafil. In case of sildenafil drug, you lab stamina increase. Labars come. In case by that policy, in case of by physics, your lab stamina increase. And by that you utilize fundamental unit or complex unit of drug, lab stamina increase. Lab chemistry. Lab chemistry. What? That is for you, lab physics and lab chemistry. In case of drug, in case of lab, for lab purpose, sildenafil, you know that sildenafil dose, sildenafil is the drug of choice, but that is if for 3 months, after 3 months, if go to the half dose, then if go to the half dose, then you can utilize that as a 3 month half dose, 3 month 90 day. If go to the half dose, then 45 days after 45 day. If go to the 1/3 dose, then go to the sildenafil 1/3 dose adult dose, 1/3 adult dose. If go to the 1 month, after 1 month, 1 month later, sildenafil. Okay, generic name of lab. Okay, fine. Those are my patient for them. Those need to lab is and utilize as a labology purpose, not sexology purpose. My pen supporter all over the world. Sometime I last lecture I was angry. If anyone say odd word anything wrong, I am also creation. I will angry by my misbehave. I am also creation proof. Creator character is unexplainable, wonderful. But as a creation, I am also creation. I have angriness. If anyone try to hit me, kill me, beat me, argue me, debate me, you, my friend, supporter just. If you they know the better than science, medical science or any field of science, if you know the better than me, then you should have right to argue, debate with me. But if you not know the better than science, if you not know the better then why argue, debate, and waste my time? My friend may supporter just. By my misbehave, I am also creation proof. And last day we see that the filariasis treatment, albendazole, mebendazole, diethyl carbamazepine, ivermectin. That is the filariasis treatment. In case of tuberculosis, isoniazid, rifampicin, pyrazine, dinamide, ethambutol. That is the treatment you remind that. If I do any mistake, you see the main book. In case of medicine main book, Davidson, I did the Davidson, Dr. Momo Shujuri did the Davidson 20th edition. 20th edition, 20 number edition. Davidson, Sir Stanley Davidson. And surgery belly and lap. You see the surgery and gyneops main book. If I do that, I am also creation. You know that so many medical science is vast. I also keep my mobile DIMS. In DIMS, I see the medical trade name. I not remind that there is so many companies, so many trade name. I remind the generic name and say the generic. Then which company is better for you? You can utilize. All over the world, 100 top class company. Then next 100. If 100 company is not available, if 100 company available, then 100 top 100 in your country, top 10 company, top 10, or if top 10 company is not reasonable price, then go to the next 10. Those are my patient. I say that all over the world. Now my friend was about in case of those who suffer the TB, mycobacterium tuberculosis, that symptom of bacterial tuberculosis, what is the infection? Infected land so many times. Already antibiotic taken, the cough is not cured. Cough remain. Then already 1 week, 2 week gone, 2 week gone, antibiotic given, there is no response, and the cough is not gone. Then sputum test. If sputum test found the TB, in case of TB gel Nielsen staining. In that staining you found the mycobacterium tuberculosis. If found the mycobacterium tuberculosis, the treatment of choice isoniazid, rifampicin, pyrazine, but ethambutol. 3 month to 6 month therapy. Understand? I think better understand. That's the treatment choice of mycobacterium tuberculosis. A test, sputum test, gene expert test. Fine. That is the mycobacterium tuberculosis treatment policy. Treatment course. Already there is the other TB. If TB is fit to the abdomen and gut and go to the bone TB, also skin TB. Sometimes in case of bone TB and in case of tuberculosis, in case of TB is severe for the bone and spread all over the body, then steroid can be utilized by the permission of doctor. Steroid for reduce the cell injury. Steroid. The steroid policy is, what is the steroid mechanism? The cell membrane phospholipase enzyme inhibitor. If steroid utilize phospholipase enzyme inhibitor, cell membrane degrade by phospholipase. Cell membrane degrade by or break down by arachidonic acid. Arachidonic acid, cyclooxygenase, lipoxygenase oxidate breakdown. but is cell membrane breakdown prevent by, aggravate by, or cell membrane breakdown help to a enzyme? What that enzyme? Phospholipase. Steroid stop that phospholipase enzyme. Steroid people inhibit the phospholipase enzyme, and if cell membrane break down to arachidonic acid phospholipase enzyme help to cell membrane aggravate that process. Cell membrane break down to arachidonic acid, but steroid inhibit the phospholipase enzyme. If inhibit, then cell membrane is not degrade or not break down. That is the mechanism of steroid. But steroid is more side effect, huge side effect. Without professor, steroid is not taken. Not, and steroid dose, tapering dose, started at the small amount to increase the dose. If stop steroid, then for example, all weekly basis, if steroid given 5 milligram to first week 5 milligram, then next week 10 milligram, next 15, next 20 milligram. If reduce the dose, first 20 milligram, then next week 15 milligram, next week 10 milligram, then 5 milligram, then next week half 2.5 milligram, next week stop. By this tapering dose, steroid should be tapering. Without tapering, not given the steroid. Thank you very much. And stop given by tapering and stopping by tapering. That is the process of steroid. Those that take steroid can be aware about that. In case of NSAID, non-steroid anti-inflammatory drug, NSAID, non-steroid anti-inflammatory drug. If you take non-steroid anti-inflammatory drug for pain purpose, NSAID, everybody, my patient is aware to take omeprazole. Not take without omeprazole. If you take NSAID, there is a chance of gastric ulcer, peptic ulcer disease, PUD, peptic ulcer disease. That is the reason with NSAID, omeprazole. In case of with food and after meal, you take NSAID, and before half hour of meal, you need take omeprazole. Some patient come in case of Europe, NSAID induced peptic ulcer disease. For that awareness, if you take any doctor pharmacy, go to the NSAID given or for pain purpose, take a omeprazole. Omeprazole before half hour before meal, and NSAID painkiller given, painkiller like NSAID take after meal. Understand? I think better. Thank you. That is the awareness necessary. Europe is in case of its division, say Europe, not only Europe, all over the world, NSAID painkiller. If you utilize painkiller as a NSAID, you should be take omeprazole. In case of omeprazole, half hour before meal, and NSAID after meal. Thank you very much, my friend, to design up for medical science club.